those na may kaya. So there are a lot of financial barriers also why the poor cannot even access basic services that is available nationwide. Furthermore, if you try to look into the different services being provided based on the National Demographic Health Survey result, the widest gap in terms of the rich and the poor occurs in the provisions of services during labor. Napaka-laki po yung diferensya. Ito po ay yung mahihirap as compared to the fifth or the richest quintile. Less than 20%, ay a little more than 20% ang mga nanganganak na may health worker na nag-a-attend sa mga mahihirap as compared to more than 80, almost 90% sa may kaya. So this is another gap na dapat natin tignan. Furthermore, so a lot of challenges. Furthermore, kung titignan, saan ba nanganganak? This is another picture na tinitig. Saan ba namamatay ang mga bata bago mag-isang sa first 5 years of their life? Basically, 50% of deaths occur during, of neonatal deaths occur during the first 2 days. Or 3 out of 4 of neonatal deaths dito occur in the first 7 days of life. Kaya importante po na ito ang critical na nandyan po tayo, hindi lang during delivery. Critical din po na importante nandito tayo sa nanay at sa mga bata bagong panganak during the first 7 days of life to provide the cost-effective interventions to ensure the survival of our 3 out of 4 are dying during the neonatal period. And you remember that almost half of our under 5 deaths occur during the neonatal period, 47%. Next slide, please. In terms of maternal deaths, the same thing. Ang pinakamalaking namamatay na nanay ay nangyayari po sa first 2 days of their lives. During labor in first 2 days of their lives. Na tugma din po sa critical period na doon din napakarami yung namamatay na neonates. So talagang interlinked, may mga serbisyo sa nanay nakakatulong sa survival ng mga bata. And there are a lot of interventions that practically will save the lives of our women and children. And next slide, this is a local data which I tried to consolidate based on the results of our maternal death review in our 8 project sites when we were in our CPC file. And you can see that 72% of our mothers occur during labor in the first 24 hours of life. 12%, 10% occur during pregnancy. Ito naman occur during after 2 weeks, 2nd week to the 7th week postpartum, and 6% occur during the 2nd and the 7th day after delivery. So, tugma po, mga local and national data shows that a critical point in the life of our women and children that we need to be there to ensure the survivals of them. Kasi alam po natin, marami na tayong proven interventions. It's just a matter of giving it to them the right way, the proper way, and the right timing. Next slide, please. Ito po, we try to look also into the neonatal mortality based on the National Demographic Health Survey. This is the latest data. Na ang mortality ng mga bata ay almost matataas, either mahirap ka o mayaman ka. I agree na medyo almost half niyan, pero kung titignan mo, yung pinakamayaman, 10 pa rin per 1,000 live births ang neonatal death rates nila. Well, compared to developed countries na dapat less than 10. So titignan, malaki. And in the same manner, if you look into the next slide and compare the neonatal mortality rates na nakuha sa nationwide survey as reflected in the National Demographic Health Survey, ang neonatal mortality rates sa buong Pilipinas is 16 per 1,000 live births. Kung titignan din naman natin yung ginawa sa 51 hospitals nationwide na ginawa ng WHO with support from BJH and DOH, nakikita po natin na pareho ang rates ng neonatal mortality rates. Bakit? Hindi ibig sabihin na kahit na pwede pala na kahit na mga anak ka na lang sa bahay, hindi ho yan ang ibig sabihin doon. We are still pushing for health facility delivery for a lot of reasons. So, bakit ganyan? This will bring me to the result of his study that basically will show why we have an almost the same neonatal mortality rates in region-wide medical centers that were observed in the country. So kung titignan, next slide. Gusto ko lang ipakita, ito yung result ng study sa 51 hospitals which they observed 481 deliveries in newborns. Okay? So, kung titignan natin, we show that the performance in timing of evidence-based interventions in emergent newborn care are practically below the essential newborn care standards recommended by the WHO in the Department of Health. Hindi po, it's below the standard. Kahit po sa regional hospitals, kahit po sa medical centers, below standard ang ginagawa pa rin natin in terms of essential. O kahit din sa maternal care. And hospital practices prevented. So, with that, the practices in our hospitals has prevented our newborns from benefiting from their mother's natural protection in the first hour of life. Okay? Ano ang mga findings na nakita natin? Tignan natin po sa next slide. Ito po. Ano ang common na practices sa ospital na naobserbahan? Ito. Ang oxytocin, 24% or 25% were only given oxytocin. Ang standard po sinasabi, lahat po ng buntis, di ba? Pero only 1/4 were given oxytocin. Pag tignan mo naman ang antibiotic, practically 79. 4/5, almost 4/5 of all those mothers were given antibiotic. Pero ang sinasabi ng standards, dapat may indikasyon bago tayo magbigay ng antibiotic. And then further review of this, ang record lang, only 10% of those that were given have recorded the indication of why they are giving antibiotics. Ang standard says that kung magbibigay ng antibiotic, ilagay mo sa record mo kung bakit ka magbibigay. But here, practices, wala. Kulang na kulang. Isa lang, kada 10 na binibigyan may record. In the same manner, ang pagbigay ng steroids during preterm labor. Sinasabi ng standards na dapat lahat. But only 23% were given steroids during preterm labor. Position of choice. Kayo po, kung magpapaanak kayo, anong posisyon ng mga nanay sa inyong clinic? Nakahiga? Sa likod nila? Try nyo maghiga at mag-iling. Madali ba? Madali? Ha? Mahirap? Madali? So sinusunod yun yung gusto ng pasyente? Anong mga example na posisyon na ginagawa ninyo?
Yung recline na sarili.
May ganon. Okay. Okay. Good. Ano pa? May inaalam nyo kung gustong nakaganon? O nakaupo? O ano na? Basta kung anong pwesto gusto. Okay, so, kasi sa na-obserbahan, wala. Basta pinahiga na lang doon. Higa. Sa delivery table. Wala nang pake. So, ang pa natin is, dapat bigyan natin ng